Hi, everybody, and welcome to those who are slowly rolling in for tonight's training, which I'm very excited to be presenting for you. My name is Talia Charney. I'll more formally introduce myself in a second. But I want to welcome you on behalf of Healthy Planet and the co-sponsor Now brand. And tonight's training is getting to the heart of heartburn. A very important topic. Many people have to deal with it various times of their lives, but especially as they get older, when my father has this. Hopefully everyone can see and hear me. I do have Wesley, who is my co-host in the background. You can't see him, so he's here to help out. And he will pop up and let me know if there's any issues, technically speaking. For a few housekeeping things just before I get done, I've actually cut and paste some details that I often get asked into the chat so that you can look at that or look at it again just to refresh your memory. But essentially a few things that are most important. One is love to take questions. I do keep it at the end to keep the flow going. So there's two areas. There's the chat area. Please use that to chat with Wesley if you want, and also to just chat with one another, share ideas and thoughts. Wesley, I'm getting a little bit of like some noise, so I don't know if you're muted. I can hear your computer. And then there's the Q&A area. So that is where you can put questions for me that I'll get to at the end. Please keep the questions there so they're in one place and your chat with one another in the chat area. And Wesley will remind you that as we go through. So Wesley, perhaps you can, whatever I've cut and paste there for now in the chat, you can copy it and cut and paste it throughout as people are joining a little bit later so that they get the information as well and at the end. I'm often asked about, is this going to be recorded? It is being recorded, and Healthy Planet, when they have the time, it's usually some days after I'm done, we'll put it on their YouTube channel. I've put the link in the chat to that YouTube channel as well. All right, so without further ado, I'm gonna get my trusted laser pointer here that I love to use and get going. So I'm talking about getting to the heart of heartburn. Hope to give you some really useful tips and ideas and food for thought, expand your mind on this topic. And quick introduction. If you attend these webinars from Healthy Planet on a regular basis, then you've probably seen me before. But for those who haven't, I'm Talia Charney, and I'm the Nutrition and Health Education Manager for Now Foods Canada, which is one of our co-sponsors. I'm a holistic nutritionist and wellness coach, an author, educator, and a speaker. You can see I have a sort of a side hobby of writing books, which I love, and I always state my training values, which are honesty, objectivity, nuance, and humility. And the obligatory disclaimer, so if you can bear with me, I'm going to read it quickly, but it is important to know that my presentations are for informational purposes only. They don't constitute the practice of medicine or other healthcare professions. No doctor-patient relationship is formed. And the use of information written or stated here or materials linked from here, and I will say also questions answered at the end, are all at the user's own risk. The content of this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So please do not disregard or delay in obtaining medical advice for any medical condition you may have, and seek the assistance of a healthcare professional for any such conditions. And thank you for your patience for that. Okay, and just also a quick introduction to my extended Now family here. So Now is a health company that is 56 years old and family owned. They have 4 generations. This is the founder, Elwood Richard. It's a great story behind this. If you ever feel like reading this book, Beating the Odds, that is included in the chat as well, the link to the website where you can download the book if you feel so compelled. Very interesting story. Okay, so let's get into our topic for tonight, and I will sip some water time to time. I got a little bit of a scratchy throat. So we're going to be talking about, these words can be used sometimes interchangeably. Heartburn, acid reflux, GERD, but heartburn is just a symptom. We feel some burning around here. Acid reflux is an actual description of something happening where you have acid coming up your esophagus. And GERD is a diagnosis, which is gastroesophageal. That means like the stomach and esophagus reflux disease, and it obviously will include acid reflux and the symptom of heartburn, but they're a bit different. Like if you haven't been diagnosed with GERD, you can't say you have GERD, but you might be experiencing or describe something as heartburn. So a little anatomy, because it goes a long way. If you kind of pay attention on this slide, it'll make everything else that I talk about kind of make more sense. So try to kind of put your thinking caps on for a second, put your cell phones away. Now, if you take your hand and you turn it sort of sideways like this, and then you dig it right under your ribs, of course, not too hard, in that area where your hand would be pushing is going to be right here at the top of your stomach. So that area where your hand will be pushing is where your diaphragm is. It's like this tissue that goes across your abdomen. Below that diaphragm sits your stomach, specifically on the left side under your ribs. So you've got the diaphragm, your stomach sitting under, then your esophagus is above it, and it goes all the way up to your mouth. So your food comes down the esophagus, crosses through a hole in this diaphragm, and you have your stomach below there. And then, at the bottom of the stomach, you have the beginning of the small intestines, and then all of the small intestines and large intestines. And so keep that in mind. Now, another important thing to note is that at the top of the stomach and at the bottom of the stomach are two sort of like doorways. The top one is called the LES, which is the lower esophageal sphincter. Here's because this is the esophagus, it's at the lower end, it's a sphincter. It's kind of like a door, it's a muscle. It contracts and it closes. You can see it's closed here so that when your food is in your stomach, and it's kind of like a washing machine here, everything is moving around and there's some digestion taking place, it doesn't go up the other way. It's intended everything to move down this way. Now, everyone can get a little bit of food coming up, and that doesn't mean you have an issue necessarily, but when it's excessive and it causes symptoms and it's chronic, then you can have something as we call GERD. So keep that in mind whenever I mention the sphincters and the importance of the tightness. You have one at the top and the bottom. Now, if you think about it just kind of logically, one thing that's going to help everything move downwards is just simple gravity. So when you're standing up, you're at an advantage already. Things are going to be going down. If you're standing on your head, that would not be helpful. So that's one thing with anatomy. Then also think of, well, anything that puts pressure up this way is going to work against you. So filling up this stomach with too much stuff could. Well, what about something pushing from the bottom here upwards? Well, below here, again, you have what we call our tummy in colloquial terms, but it's all of our intestines. And if you've got something pushing up, let's say, for example, a big stomach, you're pregnant, or anything else that I will talk about some stuff. But if you have pressure coming up this way, you might get reflux through this door and you might get reflux through that door. So keep that in mind. And that's probably the longest I'll spend on any one slide. So symptoms of acid reflux can really vary from person to person. And there's definitely ones that are more obvious, like regurgitation. Maybe you taste something in your mouth, or heartburn. You feel like a burning here, burping, gases are coming up. Just a real sense of fullness, even though you didn't eat that much, nausea or gas. These things are not diagnostic of GERD, but they're definitely suggestive. And then there's some less obvious ones, like a sore throat or hoarseness, or as I mentioned, the sour taste in the mouth. Might be that you wake up in the morning with the sour taste in the mouth. It could have been reflux at night. So not everybody has this heartburn per se. And so you can keep that in mind. That's why sometimes we need doctors to rule in or out things with different symptoms. All right, so what about eating habits and reflux? Now, this kind of stuff may seem a little bit mundane. Of course, eating habits affect your post-meal experience, but they can be hugely important. and make a big difference. So eating too fast, because the digestion starts in your mouth. It actually starts with your brain, because if you think about something, like if I think about salt and vinegar chips, I start to salivate already and have more saliva. Eating too much, because you're putting, you're filling up that stomach, which only has so much space it can stretch, but poor food choices I'll get to. Eating while stressed, because we're going to be eating faster when we're stressed. And our nervous system is not in digest mode when we're stressed. So everything that's supposed to be, like the enzymes we're supposed to be excreting, the digestive juices we need to digest everything, is going to slow down to a halt if we're very stressed, because that's not a priority for the body. Eating too late at night, that's definitely can be an issue. Within a few hours, it's going to be different for everyone. It depends on the size of your meal too, because your meal can sit in your stomach, 1 hour up to 3 or 4 hours, depending on the content of your foods. Lying down after a meal, of course, because gravity's not working for you. Snacking between meals, not hugely consequential, I think, for the most part, but can be for some people. And eating foods that trigger reflux. So this one I'm going to talk about on the next slide. Now, if you Google online, you always see a whole bunch of foods that they say sometimes to avoid if you have reflux. Now, obviously, anything that your doctor or maybe a dietitian has already recommended that you avoid, that's fine. Follow those directions. But I'm generally speaking saying these type of things will often come up. And what I want you to be aware of is that I don't recommend, in the absence again of someone, of healthcare provider telling you that you just permanently eliminate every food you see online as saying it triggers acid reflux, because it varies from person to person, and you want to keep your diet as comprehensive and as varied as you can. And not everything causes reflux for everybody. You will notice I have a fascination for lines. So when I put things, there's no order of priority. It's just simply from smallest to the longest words. The reason I have a little asterisk here for milk and caffeine is just a little bit of detail on those. The reasons they may increase the experience of acid reflux if someone's getting it is they increase a chemical that's produced in the stomach that stimulates acid production. So something like coffee, which has caffeine, can be triggering for some people, or milk, by stimulating acid production. I'm going to get to acid. Acid's not a bad thing, but if you already have excess acid or you have reflux, then it may be an issue. Mint is mixed, because mint certainly can help some people with digestion and with gas, and with other people, though, it can relax that muscle of the upper sphincter, that door, so it doesn't quite shut. So for some people can exacerbate a situation if that little door is already not closing very well. Chocolate has caffeine and coffee has caffeine. Spicy foods for some people. I love spicy foods. Saturated fats, evidence is not so strong, but for some people may be an issue. Certainly fats sit in the stomach longer. So in terms of the time for the stomach to empty, fats will hang around the longest, then proteins and carbs will go the fastest. So if you have a meal with a lot of fat, it will sit around longer. Carbohydrates, put a couple asterisks here. The reason that may be an issue for some people theoretically for acid reflux is there's certain kinds of carbohydrates, not all of them, that are highly fermentable. So bacteria love to eat them and produce gas. They get fermented. Good examples would be garlic and onions. They're highly fermentable, and for some people who have a condition called SIBO, which means small intestinal bacterial overgrowth, one of the theories for acid reflux is that when they're eating those fermentable carbohydrates, they get gas in the upper intestines from that bacteria, and gas rises and it can push upwards and is putting pressure, as I mentioned in that first slide, upwards. Acidic foods can be a mixed bag. I'm going to get to acid again, but sometimes additional acid, you've probably heard of apple cider vinegar, can help with digestion because we need acid in the stomach. And if you have low acid, acidic foods may be helpful. And for others, if you have excess acid or already getting reflux, it can make you worse. So the evidence is may help and may hurt. You kind of have to figure it out on your own. So that's the foods. Some very simple but helpful interventions, working with gravity mostly here. Get it, especially at night, elevate the bed, the head of the bed 6 inches if you can. Some people put bricks under them, under the legs. Sleep on your left side. Now, I don't recall asking someone to do that and getting feedback, but apparently just because of the way our anatomy is, you're less likely to get reflux on your left side versus on your back or on your right side. Using a wedged pillow, of course, instead of raising the bed. Avoiding tight clothing. So if your clothes are very tight, again, you're putting pressure underneath the stomach. Quit smoking. That's a good advice anytime if you can. And weight loss, and I'm talking about for somebody who may have excessive weight that can contribute to acid reflux for the reasons I said, the same reason that pregnancy can. If you have extra weight underneath the stomach, it can, depending on like how your anatomy is and how it sits, be pushing upwards and cause or exacerbate acid reflux. This is a quote from a book that I just like to read. It was current 2023. I think this is an important thing. The reason I'm putting this is sometimes, or maybe quite frequently, when people have the symptoms that seem like they could have GERD, and GERD again is the diagnosis of this chronic acid reflux, then they're just put on a prescription medication or something as kind of a trial without knowing whether they have it or not, but as a trial. So the quote here is, the symptoms of heartburn and other reflux symptoms can be caused by many things, only one of them being acid reflux. If the diagnosis of GERD is made with a hunch, so without doing tests, but just on a hunch, and a PPI challenge, now that's the common prescription drug given for acid reflux, or just a questionnaire is used, the accuracy is wrong up to 37% of the time. So that just means, if you can, maybe before going on to a PPI, if you can talk to your doctor and see, like, can we do some other specific diagnostics? Because for some people, when they try to come off of PPIs and they've been on them for a long time, they get kind of an acid reflux occurring after that when it's withdrawn, as sort of a side effect, a reoccurrence that's even worse and can be difficult to get off of them. So if you have the luxury, then maybe better to just take a little time to figure out what's going on. And one of the reasons is because there's other things that can mimic what you might think is heartburn, and that's where your doctors come into handy to do what's called a differential diagnosis and rule in or out other things. So gallstones, even heart disease, hiatal hernias. I'm going to show you what this looks like a little bit later. It's when the stomach kind of protrudes above the diaphragm, so your anatomy is off. Esophageal cancer, esophageal spasm, of course, of something much more serious. And I'm sure these things are not, not all that common, but still just to give you the idea that there are other things. Not everything is just acid reflux. And when it comes to risk factors, so why do people get GERD? It's helpful to do some exploring, encourage your doctor to do some exploring in terms of what are the root causes. Here's a tree with a root. In my experience, there's often layers, so not just one root cause, but there's several. For example, age can be one. So it might be an older person. Everything works less efficiently as we get older. On top of that, there may be some obesity. And on top of that, perhaps a history of a stroke or something. So it could be layers and a medication. So there's different risk factors. One of them as a group is just structural. So the structure that could be just how you are. Everyone has a different, the way our stomachs are and the shape of them and exactly how they sit and everything isn't identical in every person. So some people may be more prone to having an issue like hiatal hernia. You might have had a surgery that alters some of the structures, or you naturally have a small intestines that's kind of twisted, and that so these different structural changes can make one more or less susceptible. Abdominal pressure, so that's the pressure underneath the stomach. Now that can come from SIBO. I'm still going to show you a nice slide on that will make it more clear. That's small intestinal bacterial overgrowth, but could be obesity, could be pregnancy, even constipation. If you have a lot of food sitting in the small intestines and it's not moving, then you've got bulk there, and bulk puts pressure, right? If things aren't moving down. There's certain comorbidities, like if you have diabetes or fatty liver, you're more likely to have GERD. Now that can have to do with, as an example, when people have diabetes, they can get nerve damage. And we think of it like to the hands and the feet, but the nerves go everywhere and they innervate the intestines as well. And if your nerves are damaged, then your stomach may not work properly. It might not empty as fast as it should. Food may sit around. So that brings me to poor muscle tone. The stomach, around the stomach is a muscle, and those two doors above and below it are muscles. So anything that can affect those muscles and their ability to contract can affect or put you at risk for GERD. Anything that affects the nervous system, whether it's Parkinson's, history of stroke, stress, all kinds of chemicals are important in our body, and chemicals is not a bad word. It's just there's many things that go into good digestion. Just take saliva, for example. If you're not producing enough saliva, which is common as we get older, which is common on many medications, and it's associated with certain diseases, when you swallow that saliva, it goes down into your esophagus, and it helps, along with good mucus production, to provide some protection in that area from the natural little bit of acid reflux that may occur. And so if you don't have that natural protection, then you're more likely to develop erosion or irritation in that area, and so to have symptoms of the acid reflux, just as one example. But we need saliva and enough water and mucus production. All of our tissues in our body are, kind of coated as you swallow down your food in mucus to help protect the lining. We need acid, especially in our stomach. That's important for digestion and so on. And then there's medications, many that could contribute to acid reflux, and smoking and alcohol use, and aspirin. Probably many people are aware with continued use of aspirin, it can be irritating to the stomach lining and to the esophageal lining as well. So some things to think about. Now this is just to describe what SIBO is. So some people, and this is kind of new-ish, many medical doctors, say 10 years ago, would never have heard of SIBO, and hopefully many more do. But below your stomach, here's the small intestines. And although there's a little bit of bacteria naturally in the small intestines, the bulk of our microbiome is in the large intestines. For some people, for all kinds of different reasons, have an overgrowth of bacteria in the small intestines. Those bacteria will eat your carbohydrates for their dinner, lunch, breakfast, but they tend to eat what are called fermentable carbohydrates. And those carbohydrates, then they, as a byproduct, they produce gas, and that gas is going to put pressure this way. And so you might have contents moving into the stomach and causing irritation and perhaps reflux with that pressure. And that's a theory out there anyway. So if anyone's already been diagnosed with SIBO and has what they believe is acid reflux, keep that in mind. Now I mentioned hiatal hernia. So some people have, here's the stomach and here's your diaphragm I mentioned. The stomach should be sitting below the diaphragm, but it can protrude upwards. And that, not in all cases, but can cause reflux, because now your anatomy is off, reflux of the food into the esophagus. Now, sometimes it's kind of a more permanent and it sits there, but very often it isn't. It's kind of, it can slide in and out. So again, with gravity, it probably come down. There are different ways that the sliding hernia can be helped. Doing core exercises, get someone's guidance if you haven't done, not necessarily traditional sit-ups, but some strengthening your core, strengthening the muscles in the abdomen kind of keeps everything in its place. There's certain breathing techniques. I'm just relaying some information I came across. I don't know about these breathing techniques that may help. I know that heel drops is a common recommendation you'll see on websites where you're told, and say first thing in the morning on an empty stomach, to drink a cup of water or a cup of two of water. So you have a lot of just water in your stomach, and then to raise your heels and drop them a few times. What that's doing is just helping with gravity. The water weighs down the stomach, and to get your hiatal hernia to come down. There are certain manual manipulations that can be done by someone who experienced to help move that hiatal hernia. Here are some of the names. So you might look for online a chiropractor or maybe an osteopath that can do these specific kinds of manual manipulation. And then, of course, addressing some things like excess weight or constipation can also be helpful to just shift this hiatal hernia down. And there are all kinds of drugs, and it's not necessarily an exhaustive list, but that may decrease the LES pressure. So that may affect that ability for that top door above the stomach, which is a muscle, to contract and hold closed while you're digesting. And it can be, medications used for osteoporosis, for asthma, for heart disease, for diarrhea, certain narcotics and sedatives, and Viagra. So keep that in mind to ask maybe your pharmacist is a good person. Is there anything I'm taking that maybe might be contributing to acid reflux? So for mainstream management for acid reflux, heartburn, or GERD, I'm needing a sip of water here. So these are sort of the common type of remedies. One of them is antacids, which very simply work by neutralizing the acid in the stomach. Rolaids, Tums, they're just alkaline. Baking soda, same thing really. If you neutralize the acid in your stomach, it doesn't stop the reflux, but it stops the irritation because you now have alkaline contents and not acidic. Another solution is a buffer. So it's more of a kind of a Pepto-Bismol, is something that sort of coats the contents of the stomach, doesn't stop the reflux either, but when the food comes up, then you have a buffer between the tender tissue that might be irritated and the acidic food contents or whatever it is. So that's how that works. And then kind of the heavier hitters are things that actually block your own ability to produce acid in the stomach. So again, acid in the stomach and producing it is normal and healthy and necessary for proper digestion. But sometimes we need to reduce it. There's H blockers. These are sort of over-the-counter medications. And then you have PPIs, which are proton pump inhibitors. These are prescriptions, and they can block you from producing your own acid for up to 24 hours. But in many cases, these can be Band-Aids, and sometimes you just sort of left on them indefinitely without really addressing the cause. Now, again, I'm not saying, as I said in the beginning, I'm not telling you to go against your doctor's advice. Sometimes people are put on proton pump inhibitors for a very good reason, because they have developed an ulcer in their stomach or erosion in their esophagus, and you need to give it some time to heal because those can be dangerous. So that's, a good use for it. But sometimes things are prescribed just as, because they help with the symptoms, and maybe there were some other steps that people could take to reverse the situation altogether so that these are not necessary. And I want to say, this next few slides, that stomach acid is very important, and to drive home some of the reasons as to why. So here's your esophagus again. So It is not normal to have a very acidic environment in the esophagus, and it's not normal to have a very acidic environment in the small intestines, but it's very normal, especially when you're fasting first thing in the morning, to have a very acidic stomach. And what that acid does is it helps firstly with the beginning of protein digestion. You have these big, big, long proteins. It starts to unwind them and untwist them. You have certain minerals, important minerals like calcium, magnesium, and iron that rely on acid to be properly digested, as well as vitamins like B6 and B12. And there are probably many other nutrients that some of which we might not even know about because our foods are made up of complex phytonutrients that rely on acid for their proper digestion. Also, stomach acid is important to protect us against microbes that are naturally in our food, and our environment is covered in microbes. We can't prevent it, but you're more susceptible, for example, to get a foodborne illness like salmonella if you are on proton pump inhibitors, because your first line of defense against those microbes is your stomach acid. There's a higher risk of getting pneumonia within the first 30 days of going on proton pump inhibitors. There's not really evidence beyond that. It's thought that there may be a role of SIBO and bacterial overgrowth for those who don't have enough stomach acids. One of the theories, and dysbiosis, just meaning like the overgrowth of microbes in your digestive tract that are not ideal for you, or even pathogens and harmful. People who've had COVID-19 infections, for those who are PPI users, again, are more likely. I found one study about that. So, bottom line is stomach acid is important. And that's why there are supplements out there such as this, which is basically hydrochloric acid in a pill. That's the acid that you normally have in your stomach in a pill. And you might have heard of people using apple cider vinegar to help with digestion. The same sort of idea as this, but this is more standardized. And also my main issue with apple cider vinegar, of course, you can kind of standardize it if you're careful, but is it's very corrosive on the teeth. And so I wouldn't personally use it or drink it on a daily basis and with every meal. So as I said, it's normal to have a fasting pH that's very low. So when you wake up in the morning, it should be less than 3, somewhere around 1 or 2. For those who are on proton pump inhibitors, your fasting pH will be somewhere between 5 and 7. This is neutral, so that's not normal, but obviously that's what it's intended to do. There's some people who might even have no stomach acid at all. It's called achlorhydria, and that could be because of chronic inflammation in the stomach, like gastritis and such. But again, sometimes we need to keep the acid out of the stomach to help with the healing if you have an ulcer, but under most normal circumstances, that acid's important and healthy and helpful. Here was an interesting study because it's sometimes sort of there's arguments out there about like people who have digestive issues. Is it because they have too much stomach acid or not enough stomach acid? And the truth is it could be both of those. But sometimes I've heard in the natural health world, it's often the assumption that everyone has low stomach acid. And as they get older, well, it is more common as we get older, but it's not true that everyone does. But there's something interesting that was shown in this study here, comparing young and old people, that showed, now this is a meal was eaten, and this was measuring the stomach acid in both the young and old people. The darker color here, kind of the blue, elderly people. Now at fasting, before they ate a meal, they both had a really nice, generally acidic stomach here between 1 and 2 pH. So there wasn't really signs of low stomach acid. But what happened when they ate a meal, now as soon as you eat a meal, all of a sudden your stomach contents are going to become much more alkaline. So it's shooting up because your food typically is alkaline in comparison to your stomach acid. So it's normal to have this peak. But then what they saw, even though they both had similar fasting stomach acid is that the young people very quickly were able to produce more stomach acid to re-acidify the stomach to help with digestion, whereas for elderly people, it took a lot longer. So what this showed is that even with the same normal fasting acid in the stomach, elderly people, at least in this population, may not be as good at responding to that meal. So functionally, they don't work as well. There's about more than a 4-hour delay for elderly people. And in terms of like fat, for those who may have low stomach acid on fasting, we don't have a lot of evidence about who and where, but it seems like it may differ across cultures. More than 60% of Japanese people have fasting hypochlorhydria. I think the theory there might have been a lot of alcohol or excessive salt in their diet. I'm not sure if anyone here is Norwegian. Maybe you can speak to the diet there, but yeah, it may differ by culture. So some people may have low stomach acid on fasting, and others just produce it slowly, especially as they get older. Now, this particular book was written by a naturopath, so it was nice to get his experience. He obviously treats a lot of GERD, and in his experience, he said 4 decades of testing his patients. He did a particular test for stomach acid. He found that 60% of them had low stomach acid who were suffering from acid reflux, but 20% of them had excessive stomach acid and 20% had normal. So you can't assume if someone has GERD or acid reflux, you can't assume that they have too much or too little or just the right amount just because they have that, is what I'm saying. And sometimes experimentally, if it's safe to do so, we will add acid like a hydrochloric acid supplement and see how do we respond to it. Are our symptoms better or are they worse? So again, here is a betaine HCl, which is basically like a hydrochloric acid. This is just what you would see if you go to the Now website. I put the link for those of you who might have joined late or later. If you go right back to the beginning of the chat, I put a link to the website for Now, as well as other information that you might need or want. But on here, it says this is the health claim. It helps digest proteins, which is true. You need hydrochloric acid to digest your proteins. This product also includes protease, which is basically a digestive enzyme for proteins. So this is helping with the digestion in the stomach. Helps support liver function and digestion. So it's kind of a vague digestion, but I've explained to you the role of acid is very important for, again, digesting minerals, some vitamins, and definitely our proteins. So that's basically that's what's in here. Just think of it as digestive enzymes. It's contraindicated for certain people. So if you know you have an existing ulcer, peptic ulcer, or you know you have excess stomach acid, then this will not be a product that you can be taking at that time. So a little bit more about GERD. Again, this is the diagnosis for when you have chronic acid reflux going on. How is it diagnosed? There's a whole bunch of possible ways of diagnosing it. And some more specialty tests like this one that can actually see what is the time it takes for your stomach to empty. I don't know how common that one is, but there's different ways. And this Heidelberg test is a kind of simple, elegant way in which naturopaths sometimes will diagnose or will test for your stomach acid. Now, I don't know in Ontario, it depends where people are calling in from, if they're doing it now, or I know that it used to be done. Regulations can change in terms of what people can do and can't do, but it's very simple in that you would just swallow this capsule and the little tag here would stay outside and stick on the cheek, and it would go down with the string. And I had it done to me once, so I actually experienced it. It sounds weird, but you'd swallow it with some water. It can then detect the acid in the stomach in the morning, and then it can actually be pulled back up. And it sounds kind of horrendous, but it's not, and it works quite well. So that's probably how this doctor, where I was here, was diagnosing, because as a naturopath, that's probably what he was using. So what are some natural supports for these sort of situations? I'm going to start with something simple because psyllium husk is very readily available and inexpensive. You've probably heard of it. It's just a fiber. And there happened to be, it was a small study here specifically looking at a population of people that had refractory GERD. So they had GERD that just wasn't responding to normal treatments. That's what refractory means, that they were diagnosed with it, but they also had constipation at the same time. So this may be something to think about for those who have chronic GERD, not responding to conventional treatments with constipation as well, just to bring up with to your doctor. And they compared one group who was just taking the psyllium. It was approximately a half a tablespoon dissolved in warm water 1 hour before breakfast and dinner. Or they were taking a proton pump inhibitor, which is, again, the drug that stops your acid production, for 2 months. And they just compared the two. They found that it took a little longer for psyllium to work, 7 days, versus the proton pump inhibitor, 4 days, to experience relief of symptoms. But otherwise, they worked, fairly similarly. But what was different is when they discontinued both of them, the symptom relief for those who had been taking psyllium lasted a lot longer. So for almost 70 days, on the average, they didn't get a return of symptoms, whereas when they went off the proton pump inhibitor, it was only about 16 days on average. So that's just something to think about. It's not a claim on the bottle. It doesn't say for the treatment of GERD or acid reflux. So it's kind of like an off-label suggestion that you could bring up with your doctor. And then if you look at traditional treatments for acid reflux, for post-meal indigestion, that's similar to that with heartburn. Often there's the use of herbs or remedies that are called demulcents. And what a demulcent is it's kind of like has this kind of gooey texture. This will look like some body fluids, think of whatever it is that you want to think that is. But demulcents are soothing and healing, and they're meant to kind of imitate what we would naturally produce on our own mucous membrane. So to imitate mucus. And what mucus does in the body is it helps to act as a protective barrier and soothe irritation. So that's what demulcents do as a class. And one of the best well-known ones is licorice as a demulcent. There are some studies showing licorice as an effective demulcent in terms of healing ulcers of different types. This particular one is canker sores or aphthous ulcers. The type of licorice that's typically used for these purposes in the GI tract is specifically called DGL. That's deglycerized licorice. There's a certain part of the licorice that's been removed. And that part can be helpful for other things, but also can raise blood pressure and cause some side effects used long term. So DGL is a much safer option that you can use. So be sure if you're asking or following up on this with a practitioner that you're asking about DGL specifically. The now DGL happens to come mixed with some aloe vera. Many of us are familiar with aloe vera being applied after a sunburn. I've used it a lot as being soothing and reducing that, the burning sensation. And it's also known to do that internally. So it's a small randomized control pilot study showing aloe vera was safe and well tolerated and reduced the frequency of those who assessed as having GERD-like symptoms. It's a small trial, but I've heard a lot of positive feedback over the years for aloe for different things, GI related and irritation. And again, for me, I've experienced its healing effects on my skin many times. Then this is a demulcent complex that I want to show you about that's very interesting. It's called Ulcitrol. Kind of makes you think about ulcers, and ulcers makes you think about, irritated, damaged membranes. So there's no claim on here that it heals ulcers, but that's just a way to remember that this is a demulcent product. So it does say on it, though, helps to reduce discomfort associated with inflammation of the gastrointestinal tract. So traditionally, herbs that are demulcents for the GI tract may have been used for all kinds of things, gastritis, diverticulitis, anything with this irritation, ulcers in the GI tract. These are the 3 ingredients in here, and I'm going to briefly review them and show you a couple of studies of this one. It's an interesting kind of zinc called pepsin GI. Checking my time here. Okay. Mastic gum and slippery elm. So those are the 3 ingredients in here. This is again just what you'd see if you go to the Now website, some of the contraindications. So the first ingredient in here is mastic gum. It's a pretty simple ingredient, very safe. It's basically from a tree that found in Greece in the Chios area, and it's our traditional chewing gum before we had modern day chewing gum, which is no longer made from the gum of trees. It's been known traditionally to be wound healing, traditionally used for gastrointestinal diseases and dysfunctions, and its uses are supported by animal models and at least preliminary clinical trials that I had a look at a few of those. And then we have slippery elm. Slippery elm, this is like kind of a bark type of substance, as it looks here, like shavings. Also traditionally known to help coat and thicken the mucosa, to increase mucus secretions. It's often used as a prebiotic, meaning as a kind of type of fiber to feed the good bacteria in our gut. And traditionally, its uses include for heartburn, constipation, diverticulitis, ulcers, irritable bowel syndrome with constipation, and sore throat. You'll see it in a lot of sore throat remedies. So, soothing, mucilaginous, kind of slimy type of substances are demulcents. And the last interesting ingredient here is zinc. And now zinc is known to help with healing. Like if you had a kind of an injury or surgery, I've often suggested to my clients to take zinc afterwards for a while or before, because in order just for your cells to replicate and to get healing in an area of damage, you need zinc. So has sort of anti-ulcer properties, wound healing properties, anti-inflammatory and antioxidant properties. But zinc L-carnosine, which is a specific trademark type of zinc, is unique in that it dissolves well in acid. It likes to sit in an acidic environment, which is our stomach, hopefully, ideally. And this prolongs its therapeutic effect in the stomach. It allows it to hang out longer. And it's been the subject of numerous clinical trials in Japan. One of them shown here, where what they essentially did was they injured the stomach of the participants on purpose and then had them take the zinc L-carnosine in this particular dose twice a day, which is the exact amount in Alcitrol that we use based on this trial, 37.5 milligrams twice a day, or placebo. And they found that for the placebo group, they had a 3-fold increase in permeability in the stomach. So permeability, if you have, that's the same thing as what you often hear as leaky gut. If the lining is too permeable, it suggests it's been damaged. Whereas for those who took the zinc L-carnosine, there was a significant 75% reduction in stomach injury and 50% reduction in small intestinal injury with the use of the zinc. So that's, I think, even though a small study, an impressive result. I want to talk about a little bit briefly, and we're close to the end, about H. pylori bacteria, because it's often related. For many people, can go hand in hand with GERD. People who have GERD are often tested for it. It's a bacteria. I know it's very creepy looking, or maybe you might see it as beautiful or interesting, depending on yourself. But all mammals traditionally have been known to house H. pylori bacteria in their stomach. 80% of us who have it have no symptoms. So you could have it, but not know. But, once you have something like GERD, you're often tested for it. And because certain, not all, but certain subtypes of H. pylori are associated with gastritis or even stomach cancer, things like that, it's just routinely treated and to get rid of if you're diagnosed with it. And depending on the type of H. pylori and where it is in the stomach, it may increase your stomach acid production or decrease your stomach acid production. But the issue with it is when you're being treated, and this is how it's diagnosed, it's actually with the breath test, is that you're put on, it's called triple therapy, which is proton pump inhibitors, that's stopping your acid production, combined with 2 antibiotics. So it's a strong treatment and you're getting 2 antibiotics at once. So one thing you can consider is anytime we're doing antibiotics, of course, now it's quite routine to give probiotics, so that won't come as a surprise. This is I typically recommend a very high dose probiotic for cases of antibiotics. This is 100 billion. But also Saccharomyces boulardii is something you might be less familiar with. It's also it's not a bacteria, but it's a type of a yeast. And it says right on the bottle, helps to reduce the risk of antibiotic-associated diarrhea. So it's just kind of to prevent that those sort of irritating side effects that can come from taking 2 antibiotics. Interestingly enough, going back to Ulsatrol and the zinc, the specific zinc in here, it was also tested in a clinical trial for people with H. pylori, a small trial. 303 patients were randomly assigned either to the zinc L-carnosine twice a day at a lower dose, which is what we have in here, twice a day at a higher dose, and a group that just took the triple therapy that I just talked about for H. pylori. So they all were undergoing triple therapy, but these ones didn't use the zinc. And the bottom line in the outcome was the success rate of the mainstream treatment of H. pylori was significantly improved by adding the zinc L-carnosine. When they doubled the dose, they didn't see much of an additional benefit, but they did see side effects because zinc can, if you have very high doses, can make you feel a bit nauseous and cause digestive upset. So again, that's why we stick to the 75 milligrams twice a day for that. Now with this triple therapy, it's not always successful. There's about a 10 to 20% failure, and that means then it has to be repeated, and that means more antibiotics, and that's never a good thing. One of the theories as to why does this happen is because of something called biofilm, which your dentist may have mentioned, or it's kind of more of a buzzword in the last 10 years. Biofilm is something that we're getting to know more and more about, but we still don't know too much about, but it's our immune system, or not our immune system, but these microbes that live in us, say like H. pylori, have this incredible ability to build this kind of safety, mucousy bubble world surrounding them that protects them from our immune system, making it very hard for something like antibiotics to eradicate them. And this may be why some things are so stubborn. And so in mainstream medicine, they are testing out the development of drugs that can destabilize and break up these biofilms. I'm not sure if there are any in existence right now, not that I know of, but we do know of a natural one, which is NAC. It's already used in some cases for issues of the lung, where there's a lot of mucus in the lung. The same idea, because it helps to break up mucus, and a biofilm is kind of a mucousy barrier. So there was this trial here using 600 milligrams, as is here, 1 week prior to triple therapy, and then it was stopped during the therapy, and there was a higher success rate. So, it's just an easy add-on to hopefully make that treatment more successful. And very last, I just want to mention, and this is kind of an off-label preliminary suggestion, not a ton of evidence, but I thought the study, although small, was very elegant and very interesting, where they took 9 subjects that had GERD, and they gave them melatonin 3 milligrams a day for 8 weeks. Now, why would they even try this for GERD is because we actually produce melatonin in our digestive tract. Has many roles. There's many binding sites for melatonin, and it can have a role in pH and other things. So we're just sort of learning about what it does. But what they showed in the group that had the melatonin for just 8 weeks, one thing here was they had double the LES pressure. So that door at the top of the stomach was, so we can say like twice as strong in staying closed. The pH in the esophagus was much more favorable. It wasn't acidic, suggesting less acid refluxing. Symptoms of heartburn were 0 versus 7. So I thought it was very interesting and something, again, you can consider, talk to your doctor about. Melatonin, people obviously use it more so for sleep, but it's just another side, perhaps, job for melatonin. And for those experiencing delayed gastric emptying, and this may be common again for someone with diabetes or otherwise, you feel like your food is sitting in your stomach for long periods of time. Now there are, for people who have a real issue diagnosed, there are certain drugs out there that are called prokinetics, meaning they help to move the food down the digestive tract. But there's some natural products that have a little bit of evidence to do that as well, such as just basic ginger, peppermint. Again, peppermint can be either way, can be helpful or bother someone with acid reflux, just depending on how they respond. And I said, and prescription medications. There was one study here just combining artichoke and ginger. And that brings me to the end. So thank you so much for everybody who patiently listened through. I hope you learned something new tonight.